right, the late Dr. Stella Adadevoh will always be remembered for huge sacrifice she made in 2014 to save Nigeria, what will have been a public health emergency of unprecedented proportions. She single-handedly overpowered an escaping Ebola virus disease patient and prevented him from mixing up with the throng at the overflowing Obalande bus stop here in Lagos. 6 years later, Nigeria, like the rest of the world, is still in the throes of a global pandemic, with the government doing all it can to prevent the community spread of COVID-19 virus. But is Nigeria getting it right? Can those be compared with how Ebola was summarily dealt with? Even as health experts have argued that the circumstances are not the same. Today, Dr. Adadevoh's Health Trust has dedicated to her name, and joining us now for a conversation on the Dr. Ameyo Stella Adadevoh Health Trust, Nigeria, COVID-19 and beyond, is Niniola Williams. She's the Managing Director and Chief Executive Officer of that Health Trust. She's here to talk about the support for Nigeria's COVID-19 response, an effort to build a stronger and more resilient healthcare system by investing in the health workforce. According to her, to achieving this, we need to seek support and partnerships. We've already gotten financial and in-kind support, but we need more. Welcome to this program. I think you were here a couple of months ago and we talked about this. Yes. If you can do an assessment of the COVID-19 climate, what has changed and what can we do better?
I think we've done well. Nigeria we're very good at dealing with infectious diseases. We've had, in our history, if you look at other countries, we've had to deal with things like Ebola, of course. Lassa fever we have every single year. It was discovered here in Borno State in the town of Lassa, so that's something we're used to. Meningitis, monkeypox. So we have some capacity to deal with these things. But I think the challenge is that with COVID-19, for example, and even with Ebola as well, we're very reactive. And so we need to learn from these things, and where we see there's room for improvement is to become more proactive in managing these kind of things and preparing for them. Because we know that with public health emergencies, if you're not prepared, there's no doubt there will be lives lost, because in the time it takes to set up isolation centers and bring in equipment and do all the necessary things, people are getting infected and dying. And so we really think that there's a need to learn from this to be more resilient in the future by being prepared.
Can you truly be ever prepared for health emergencies such as this? And I ask because we've seen COVID-19 undermining the best of healthcare facilities around the world. So can we truly be ever prepared?
I think COVID-19 is unprecedented, as you've rightly said. Everyone in the world is struggling to manage this thing. Every country is using different tactics, different strategies, and we're seeing that it's a challenge, it's hard. However, I do think that there is a need to be prepared, because even if you cannot stop it outright, you can mitigate it. You can, reduce the impact of it on human lives, on the economy, and the country as a whole. So I think there's still value in ensuring that we're well prepared for whatever will come next, because unfortunately, we know COVID-19 will not be the last.
Well, let me ask you, what have you been doing at the Dr. Adadevoh Health Trust in terms of engagement with the fight against COVID-19? And I know the last time you were on this program, you talked about, support for the efforts of that health trust. Have you been able to get some support, and what programs are you working on?
Yeah, so we have gotten support. What we are doing is supporting government, and the way we're choosing to do that is focus more on the health workers themselves, because of the legacy of Dr. Adadevoh and her colleagues. As you said already, we've seen the evidence of when a small group of health workers is equipped and given the right skills, they can identify and contain an infectious disease, and in that case, save an entire country. And so what we're looking at is, while there are people focused on isolation centers, the hardware of the response, we're looking at the software. How do we invest in our health workers to build a nationwide network of people who are ready and able to identify these things and also ensure that they're protecting themselves in the process? And so right now we're establishing Nigeria's first ever IPC Simulation Training Center, which is going to be like an academy. And we're doing it in the legacy of Dr. Adadevoh and her colleagues. We want this to be something, the whole nation can be proud of, something that will ensure that we're more resilient and stronger in the future. Because we know that during COVID-19, for example, a lot of health workers were just thrust into this thing. They had no idea what to do. You can imagine if you or I were sent to the front lines of a battlefield today and given some weapons, we would have no idea what to do. We would even probably make a mistake and possibly injure ourselves or others in the process. And so this academy is really our way of contributing to the country's level of preparedness for these kind of public health events.
We've been having back and forth with resident doctors in this country. I mean, they'll say they'll strike, and the next thing, it'll suspend it because of the interest of the nation. And we know that one of the key reasons is how they are being remunerated for this COVID-19 effort. I mean, you've got some views on this, or how we can sort this out?
Yeah, I think it goes back to what we're saying. You know, we focus a lot on the physical infrastructure of our health sector, which is important. Of course, we need, you know, good hospitals, good equipment. But at the end of the day, if we don't invest in the health workers that are running the system, we're not going to have a sustainable and successful health sector. And I think that's an area that we really need to critically look at as a country, understanding that we're only as successful as our people. As much as we support them and give them what is required, then we ourselves can benefit from that.
Infection Prevention and Control Training Center. 10,000 to be trained each year sounds very ambitious. Why is this so important, and what sort of challenges are you encountering? Because the story is out there. Nigerian medical professionals train in Nigeria and they're exported abroad. So do they even want to remain in the country in the first place?
Yeah, I think it's a challenge because it's hard to operate in a place where you don't feel valued, you don't feel that people are investing in you, you don't feel that you have what you need. And that's why we're so focused on this, because we can build as many hospitals as we want, but until we invest in the people who are going to work in those hospitals, until we ensure they have what they need to do their work successfully, we won't be able to really have a strong health sector. And we've seen what it can do. And so really, this academy, yes, it's ambitious to want to train 10,000 people, but it's urgent. We don't have time. We're facing a pandemic today. We don't know what's coming next. We don't know where it's going to come from. And so we need to ensure that as many people as possible across this country are well trained and they know what to do. There's something about women who, you know, Ebola was identified, the first case was identified by a female doctor, the same thing with COVID-19. But we need to ensure that we have more of these kinds of people around the country. We don't know where it's going to come from next. Ebola entered through Lagos, COVID-19 ended up in Ogun State. We don't know where the next one is going to be. And so it's very, very important that we have this network of people who are ready and capable of responding.
The challenges that you encounter.
Yeah, it's hard. I mean, trying to do this kind of thing, we're a small organization. We're partnering with all the technical experts. We have what it takes to get it done. But we really do need support. We need financial support. We need in-kind support to scale and get to where we need to be. Because again, we're not doing this for profit or for ourselves. This is for our country. This is something that Nigerians can be proud of, something that is built on the legacy of, you know, a team of health workers who sacrificed themselves for us in 2014. And all the health workers since then who have been involved in various outbreaks across the country, many that we didn't even hear of because they were able to, you know, manage it successfully. So we need to start looking at them and paying attention to them and doing what's required to make them satisfied and to give them what they need to be safe while they work. We already have a shortage of health workers across the country. If you look at just doctors, we have less than 4 doctors for every 10,000 people. So we can't afford to keep losing them. Either they lose their lives or they leave the country. We have to start investing in them.
Well, you say we've done well managing COVID-19 and the challenges associated with it. I guess you are probably assessing government. Will you say the same about the people of Nigeria who seem, after the initial fears, who seem to have just moved on with their lives? People don't follow the protocols again. They hold parties. They defy the guidelines. What's your observation? Or do you think this has been encouraged because of the attempt by government to open up sectors of the economy and ease the lockdown?
I think it's hard. You know, it's very difficult to keep these public health measures in place for long term because people are suffering in the meantime. You have to weigh the public health benefits against the consequences to our economy. And so I understand the need to ease lockdowns and all of that. And of course, in doing that, you know, people will relax and think, oh, it's gone and we can just continue. But we've seen it with every other country. It's a human nature is for us to be social. You know, we're not meant to be isolated human beings. We don't operate well in that situation. And so it's normal for people to want to gather and all of that. What the advice is that do so in a safe manner because it's not gone, it's still here. And we don't know, you know, if we're going to have a second wave as we've seen in other countries.
Real quickly, I just want you to take me blow by blow and step by step about support gotten thus far and how, you know, how people have benefited from that support in terms of training.
Great.
I also want to know if you are making new set of epidemiologists all over the country or you are just making new set of contact tracers.
So yeah, so the support gotten so far has helped us to train over 2,000 health workers. And we've actually also started training other sectors. Though health workers are the reason we started and founded the organization, we found that we're getting calls from people in aviation sector. For example, before the domestic airlines reopened, they called us, like, can you come and train us? How do we stay safe when flying in this COVID era? Schools are who we're working with now. Also religious institutions. We've trained military, we've trained hospitality. You know, hotels will say, what are our protocols? What should we be doing to keep our staff and our guests safe? So there's a lot of need for this kind of training across the country, and we're already seeing the impact of what we've been doing. And that's why it's so urgent that we get more support to do more of these kind of activities. And the idea is that we're not just training any single category of people. We're training everybody because we don't know who is going to be the person that will be face to face with that infectious disease one day. So we need to be as diverse as possible in the categories and cadres of staff that we're training. And so everyone from the ambulance drivers to the cleaners in the hospitals to the doctors themselves and the epidemiologists and the contact tracers, those collecting samples, those working in the labs, we've trained everyone and we will continue to do that.
There is one thing that we could have done differently as regards the COVID-19 response in Nigeria that could have changed the narrative altogether, like we did for Ebola. Did we underestimate COVID-19?
Yeah, I think a lot of countries around the world did, and that's why we're in the pandemic we're in today. You know, a lot of people felt it was just a China or an Asia thing. It's not going to reach us here. And I think the biggest lesson to learn from this is that we live in a globalized world. Infectious diseases do not respect borders. They don't care about passports and visa. They move. And in the world we live in today, we need to be prepared for whatever will come next. We've seen what has happened with COVID, and so we really need to learn from that and find ways to strengthen our national security, because at the end of the day, this actually is a national security issue.
Beyond the COVID-19 and the training program that you have in place, what are the future plans for the Health Trust to keep it going?
Yeah, so we've established health and hygiene clubs in secondary schools. Unfortunately, of course, this year we've not been able to manage that program very well because schools have been closed. But our idea is to have what we call our JASA ambassadors, Dr. Ameyo, Stella, Adadevoh ambassadors, these youth that work in communities and help us to do the work that we're talking about, looking at issues of hygiene and sanitation, looking at issues of illness in the communities. How do we ensure that there's not one community that's suffering from some communicable disease that nobody knows about? And so we ourselves cannot be everywhere, but we have these youth, and through our clubs, they're trained and they go out in the community and do the work. And that's a program that we're hoping to scale again once things open up post-COVID.
Well, thank you very much, Niniola Williams, for joining us again on the morning show.
Thank you.
And all the best with the Dr. Adadevoh Health Trust.